Welcome to the Ambulance Signatures webinar. We will focus on the different signatures needed for an ambulance claim and the ambulance documentation. I'm Tom Ryan with Provider Outreach Education. I'll be your presenter today. Today, I'm joined by Mary from my team, and she's going to help with those questions in chat. I'm going to have her put some resources out there, especially for those of you that asked a question but it wasn't built in, or you have a different information that you needed. I will be answering those at the end, but I want to make sure that you have resources. There may be stuff that Mary's asked to look up. So that's kind of where we're at right now. I want to remind you that there is a disclaimer at the end of the presentation, and the disclaimer just kind of talks a little bit about WPS and the information and how we use it. All right. So what is our goal today? And our goal is to help you avoid denials due to ambulance transport signature issues. That's really what we're doing. Why are we doing this? There are $70 million in ambulance denials for the last quarter of 2025. Again, $70 million, which is a lot of denials, and this is part of that. To do that, we have to look at the types of signatures that are required. So we're going to look at the emergency medical technician signatures, the patient signatures, and the facility signatures. I want to remind you first, though, and this was one of the questions that came in, is when I say EMT, that includes 3 levels as defined by CMS. So the 3 levels include EMT Basic, Emergency Medical Technician Basic, EMT Intermediate, and EMT Paramedic, EMTB, I, and P. So any of those are what we're talking about here, any type. However, in your state classification, they may be classified differently. For instance, the question that actually came in says, does this apply to paramedics? Now, the answer is yes. And I understand that in your state, an EMT and a paramedic are classified differently, but CMS doesn't classify them that way. That's why we're going to use the CMS classification. If you have questions that come up because of that, like how your state classifies versus how CMS classifies, please put them in the chat and let me help you through that process, all right? So let's first start off with the EMT. This are important reminders because, again, any of the state levels, we're going to talk about the EMTs. So first, someone asked, is legibility an important factor in a signature? Now, I'm going to say legibility is absolutely an important factor, and it's an important factor not just for the EMT, but for a lot of other things. And the other things are the facility and the patient. But for the EMT, there's a couple of different things you need to be aware of. First, legibility absolutely counts for a handwritten signature. Many EMTs are getting away from that, and that's part of the electronic medical record. Not a problem. We do take electronic signatures as long as they meet the requirements. So that's great. So that has been something that has happened. However, someone asked, can the EMT actually sign their run sheet? Well, sure they could. They can sign their patient care report. That's no problem. That still needs to be legible. And if it's not legible, then we need to incorporate something else to help us understand what that mark indicates. I'm going to call it a mark versus a signature. A signature I'll call legible, a mark we'll call not legible. So those other things could be an attestation statement. This is what my signature looks like. I'm going to attest that this is my signature. Also, you could incorporate a signature log. Now, a signature log is a one-time log where it has the person's name either printed or typed or computer generated, and that's all good. Then next to it, it has what their signature, what their mark looks like. That's a signature log. Those we do recommend that you periodically review them. I looked up some data and statistics on that, and one time it said, hey, did you know that every 5 to 7 years your signature actually changes? I didn't know that, but I found it very interesting. So it's just a recommendation that we have. It's not a CMS requirement to check that every 5 to 7 years or anything like that. What the requirement says, we have to be able to match. If you're using either an attestation statement or a signature log, we have to match the run sheet, the patient record, whatever you want to call that today, you have to match that to the signature. So yes, an EMT signature does need to be legible. Okay. What are the acceptable forms of a signature? The question is related to the bottom one, and I'll talk more about that in just a moment. But it is a handwritten signature, and that's what we talked about, and that's where the legibility came in. On the next one is an electronic signature, and yes, there are requirements that go with that. Your system has to show something that says verified, communicated, signed by a statement, and I'll talk more about that later on, but it has to give that. It should also be dated. When did they enter the system? So that there should be a unique username and password for that person, which then somehow indicates on there. So that can be verified electronically, submitted by, not sure what verbiage yours uses, but it needs to somehow indicate that. Hopefully that makes sense, and I'll get a little bit more into that if we want to. CMS does indicate that there are limited times in which a stamped signature can be used. Now, keep in mind, the first item you're going to read is don't use stamped signatures. The second item you're going to say is unless there's a reason or a disability or something like that. So I wanted to bring it up in that way. Yes, stamp signatures are able to be used, but they're just very rarely used. So um, when you look at a handwritten signature, one thing to keep in mind is that as long as we can identify who it is, they can sign it however they want. That's why I called it the mark. Um, What does that mean? Well, that means the mark has to be consistent. So if someone says, hey, on a handwritten, they use my initials. So for instance, my name is Tom Ryan, so I use TR. If underneath that, there's something printed saying Tom Ryan, comma, EMTB, that would say that, hey, this mark above could be my initials, could be like an X or a squiggly mark, all of that is normal. It represents Tom Ryan, comma, and that I am an EMT basic. So hopefully when we look at handwritten, we understand legibility is important, but if it's not legible, how are you then communicating that to us? You could give us a signature log. Great. You could give us an attestation statement for that claim. You could have it directly printed below it. All of that's okay. So hopefully that makes sense to everyone, and I answered those few questions that we got regarding this and the acceptability information. One question that we did get is who's required to sign? Now, keep in mind this did come with a caveat, which is the next slide on does the driver need to sign? So we'll talk about each one. So who's required to sign? It is any EMT in active treatment or evaluation. And I want you to put the two together. Are you the treating and evaluating? Then there has to be one signature. If you are the treating, but someone else did the evaluation, there's two signatures. And if you really think about that, what they're signing is to say, this is my work, I did this. So who did the work, that's who needs to sign. CMS does go on to further say, hey, when you're signing it, whoever is signing it, do it as quickly as possible after. Now they do that so that if you get called out on a second run or something and it's just not possible for you to stop and sign it immediately because of another emergency run or something else, you can take that notes later, you can do what you need to do, but they want it done as soon as possible after. I was asked based on that, is there a time frame? And the answers are no. Okay. So please keep in mind there is no time frame. They don't give like, hey, it has to be done in 12, 24, 36. What they do say is it has to be signed before you bill it. Before you bill it. So hopefully that kind of helps you. But again, it's really hard for CMS to say it needs to be done this way in this situation with an emergency medical technician who's probably busy treating patients. All right. CMS does go on to further say it does need to have a date and it does need to include their credentials. Now, the credentials is just that we know that if the transport is done at a higher level, let's just say a specialty care transport or an SCT transport, that the person that did the evaluation is actually credentialed within the state at that level. So that's what we use them for. It's because we don't want someone who's doing an EMT, or I'm sorry, doing a specialty care or advanced care, ALS level or SCT level. We don't want a BLS or B, EMTB, to do those assessments. That doesn't work for the Medicare program. So hopefully we got all that cleared up and that answers those series of questions. All right. If not, throw that back in the chat. All right. All right. So who's not required to sign? This was a great question, and I did love this question. The person specifically was asking about two people, and that's why I put this slide in. They asked about a driver who's not actually involved in the care. No, that driver does not need to sign at all. We don't know that that driver has anything. We assume they have a license and that they're good to go. We don't really need to know that. Um, so what we do need to know is that the person signing has an active license, and if you're required to give us that, we'll ask for it. It's not something you have to send every time or anything like that. We don't necessarily require it for a medical necessity review. On the other hand, there may be other contractors that may want to look at that and they'll ask for it if they need it. The driver, though, is not required to sign or doesn't need to be there. We did have a question come in, and they have a situation where, depending on how fast they have to go out again, some of their EMTs will actually use a scribe, and they'll take that information and scribe it into a report, and then the EMT takes a look at it. Yeah, they still do need to sign that. The EMT, the person that did the work, needs to sign that to say, yeah, the scribe got it right. But the scribe themselves, like whoever typed it, keyed it, they don't have anything to sign. They can say scribed by or given information. It's not wrong. It's just not required. So I want to make that clear. It's not wrong to have them sign, but it's not required. So by not being wrong, that means that, hey, if they don't sign it, we're not going to issue you a finding on it. Hopefully that makes sense. So if it's someone who's simply driving, nope, don't need their signature. However, if they did any part of the patient care, including part of the assessment or taking part, transfer of care to a facility, then yes, we do. I'm trying to think of any other situations, but those are the ones that come to mind. So again, if you have questions, put that in chat for me if you wouldn't mind. No signatures. So first of all, a no signature is done in a medical review format. So we will request records or another contractor will request records. That's how you get a no signature. We assume that if you're billing us, you have the signatures on file. We do not require documentation for every single claim. Actually, last statistic I have, 95% of our claims never get looked at by a person and they process perfectly, and that's amazing. Now, on the other hand, there's a variety of reasons you may be looked at, and it's not always about, hey, it was me. Sometimes it's about cert, and they're kind of, oh, yep, we're going to look at some random stuff here, right? No, yep, okay, you got selected. Sorry, that will happen too. Now, what happens is if there is no signature, you don't meet the basic requirement because this is something that is required. So you'll automatically get a denial. The denial isn't medical necessity. The denial is actually there's no signature. We can't even complete the review. That is something that will be filed through an appeal because that's the denial rights you're going to get. But what will happen is it will go back to medical review of some sort and have them actually review the claim because it was denied for no signature, so no medical review ever occurred. What that means is that you will get a new remittance notice with a different reason code. And that reason code will then indicate that there was a review completed, but what happened with the review? Was it not medically necessary? Was it not at the level of service billed? Something like that. So it's going to be different than a no signature. Okay. So we wanted to put that in because that was one of the questions we got. I do want to let you know that if we're looking at no medical review and there's no signature, this will also apply to the patient. If you don't have a patient signature and you're not indicating that, then you can't bill Medicare. The patient has to authorize you to bill Medicare. So in that case, it's the patient's responsibility until such time as they authorize. And no, they don't have to do it before the transport. Somebody asked the question about that, and we'll talk more about that in just a little bit. Okay, so that's a no signature. When we look at the next set of slides, this is about the patient. So I'm going to take a second here before I leave the EMT, and I wanted to see if Mary has any questions in the chat for me, and then we'll go through the pre-submitted questions all at the end. But Mary, was there anything in the chat?
Hi, Tom. We have one unanswered question. It's a great question. Are students required to sign a trip report if they are in training but providing the treatment?
Great question, and no. The person who's going to bill for it is required to sign it. Now, can you have something more in place? Absolutely. So let me state what that means. Could you require a student to sign so you can say, yes, they did? What Medicare is going to say is, okay, who's the EMT who's monitoring, walking, and actively available for that EMT student for them? That's the signature we need because that's who the service is going to be billed under. Let me just ask Mary, anything else that you think I should add to that?
I think you've covered it. Thanks, Tom.
Okay, perfect. All right, so Mary did indicate that was our last question, so we're going to go ahead and move on to the patient. But again, I want to give you the opportunity and let you know, please put questions into the chat. So one of the first things is to make sure that we cover acceptable patient signatures, and that's really what this section is about, because there's some interesting questions that can be used with this and that have been asked. So we'll get more into that. Okay. One of the questions is, let's start off right away. When does the patient have to sign? Well, it's not at the time of transport. It's before it's billed. And we'll talk more about that in just a little bit. So the first question we got is, why does the patient need to sign it out? Like, why can't we just bill it? Well, first, what we're taking a signature for is to prove that a transport occurred. Second, we need a signature to allow you to file a claim. Depending on how a statement is written, this could be one signature. Okay. Again, depending on how the statement is written, it could be one. But there are times when some of the transport records come in and the run sheets come in and it actually has two patient signatures on it. That's okay too. It's just how did you write your statement? So if you write it in, and it says, hey, this allows us to submit and okay, yep, we're good. Hopefully that makes sense to everyone. It is acceptable to have a patient squiggly mark, and no, you don't need a separate line or something else with that. On the other hand, you have to be able to tell us who the record belongs to by the patient's name, date of birth, and sex code. Those are required elements for a Medicare billing. It's not anything to do with it other than the claim needs it. So we do need those. So we're going to assume that if this is signed down there and there's no other indicator anywhere else, we assume that that is the patient who signed it based on the other place within the medical record. So hopefully I'm getting that answer to the question. I didn't read the exact question nor provided that actual verbiage, but if not, please feel free to put that back in. Okay. Um, I was asked if signature on file is allowed for ambulance claim. What we answer is this: CMS does not exclude the use of it. What they do say is it is not your best practice because of the type of claim you are filing. So by not excluding the use of it, if you're doing something like a repeat transport, I'm making that up, but um, then yes, you could totally use it. A repeat transport would be something like dialysis or chemotherapy where it's scheduled. So that would be possible. Otherwise, what they say is it's the best practice to have the patient sign for the individual claim. You do not need it at time of, oops, you do not need it at time of transport. You don't need to make the patient sign at time of transport. On the other hand, you do need to have them sign or attempt to get the signature before you bill. Wait a minute. They have to sign the claim? Only they're allowed to sign the claim to get? Not necessarily, and there are some exceptions because we know there are times the patient is unable to sign. So let's talk about that next. Okay. What I like to do with this one is to tell you first, unable to sign means mentally or physically unable to sign. It doesn't mean they don't want to. It's not part of it. Now, if you can justify why they don't want to equals a mental problem or a mental situation that happens, sure, that counts. but you need to document it. Um, we actually had an appeal that came in where there was information about the patient's state of mind, finding out after the fact why they didn't sign was a mental issue. Well, that would have been good to have documented when the medical records came in so that when the original medical review happened, they wouldn't have had to do the appeal, right? So that's what we're looking for. Um, so if you're interested in this information, and I did provide a link right on the slide, otherwise you can go to the CMS website and type in the information for guidance on beneficiary signature. It's great. This is guidance that happened in 2009, but is still active today. It's still active today. Okay. I know the update says or 2009. I get it, but it's still active. I'm going to take you out there very simply by just simply using the link provided on the slide. I'm stalling for those of you that are wondering. And I'm trying to get the CMS website to open so you can actually see this. There we go. So you can kind of see a little bit of background and introductory information, but what it will do is walk you through what you need, then who can sign, and it'll walk you through step by step what you need to make sure you have the different pieces of information. Now, again, this is from the Code of Federal Regulation, and this is to make it easier than having to go read the entire Code of Federal Regulation. It is available to you in the Code of Federal Regulation. For those of you that don't know what that is, you will hear CFR commonly for the Code of Federal Regulation, and it's the codification of the law. So the law says this is what happens. The Code of Regulation puts it together in a usable format in which you're allowed to comment on, and then CMS works it in. So a little bit more going on there. It just kind of works your way through this, kind of works through everything you have. But I really wanted you to see this. For those of you that are not familiar with it, you can come to the CMS webpage, go to Medicare. Now, when you're in Medicare, you have to find it here. So that's where you're going to look through. I just have to find the right one because it just jumped out of my head where it was. So you're going to look through. Now, I don't like to do this. This is my thing. I'll type this. Ambulance up in the top. I'm going to look for the service center because I think it's way easier than trying to dig through that. Okay, here it is. What's great about this is if I open this service center, it gives me all of my resources, and one of those resources is under an ambulance education resource because remember I told you it came from the Code of Federal Regulation. This is a resource. So if we open that up, there it is right there. Now, if you said I just want to type guidance on beneficiary signature because I know the title, great, you can do that too, and it will take you directly to the PDF. I just wanted you to see that the Ambulance Service Center is a really important tool for you when you're looking for anything. Hopefully that does help you a little bit. I'm going to jump back to the slideshow real quick. So again, if they're unable to sign, document why they're unable to sign. If you haven't documented that, you won't meet the information within this document. So using a generic statement such as patient unable to sign isn't going to be enough. We have to know why today at this moment they're unable to sign. Somebody did ask a question and what their EMT is documenting. I'm trying to read through the question. I apologize. Okay, so what their EMT is documenting is that the patient's unable to sign because they have blood on their hand. Except why does that make them stop signing? Could you give them a pen and throw it away? Could you give them a pen and sanitize it? Why does just because they have blood on their hand make them unable to sign? The other question was the patient has a crushed hand, so they can't sign. Okay, yeah, I would guess that would be what you want to document. They have a crushed hand. It's part of what we're transporting them for. They can't sign because the hand is crushed. Okay, well, that makes sense to us. The further portion of that question is, can we require it to be from the other hand? And could they just put in X? And the answer is yes, it can be from the other hand. And yes, it could be an X. As long as somewhere within that run sheet or within that medical record, we can determine who it is. I think I got all those. Just looking. Yep. Okay. So there's a lot going on with that. The next section would be facility. So I do want to stop again, and I'm going to ask Mary any questions in the chat while I was presenting the patient signature information.
We do have some great questions in the chat. The first one is, Is a one-time authorization allowed? And if so, would you need to put an expiration date on it?
So one-time authorization is allowed. That's what the signature on file indicates, the SOF or the signature on file on the claim. Perfect. Remember what CMS is, it's not that it's not allowed, it's just not your best practice. I did give the example of the end-stage renal disease transports for dialysis or the chemotherapy transports for cancer. Either one of those, yes, definitely allowed. No, they don't expire. It's not like it expires in 60 days. So there's nothing like this. It's not like it expires in 120 days. No. How it expires or the way that that is ended, the way that that is ended is a patient has to revoke it. So hopefully that makes sense. Um, Mary, do we have another question?
I think you did a great job expanding on that. We got about 3 questions about, using a one-time authorization.
Okay.
Does it expire? Is it good for future transport? So I think you've answered all of those already. And if not, please, those of you that sent me a question or you need further clarification, go ahead and put that in the chat. But we have another one that's an interesting one, Tom. What are the rules on an authorized rep's signature?
Okay, so an authorized rep would be, and I'm just going to use a legal definition, would be someone appointed by the state to work on the patient's behalf. That's what we're looking for. And as long as that is the case, then yes, they're definitely can sign. They can sign for anything, right? That's okay. Now, I'm not sure what else you would use for an authorized rep. I don't know that, so I don't have that. Now, on the other hand, if you said, hey, the spouse is just here and signing to say, hey, yes, this transport occurred, Medicare will allow that so long as it's marked. This is a representative. You could use the word rep, I don't know, whatever you want to use there. Rep or representative telling us, hey, yeah, this transport did occur. Here's the representative of it. The thing is, and one of the reasons that sometimes people get kind of hung up in that is you have them sign it at the beginning, but did the transport get completed? Because until it's completed and you're at a valid destination, it's not billable. Let me give you what that means. If your ambulance breaks down halfway through, is that where you really intended to leave the patient? The billable transport is when it arrives at a valid destination for Medicare. Therefore, even though they signed at the beginning, it might not be allowed for the entire transport to say it occurred. Um, if you have more questions on that, I guess I'm going to have to ask you to put that back in chat because I'm not really sure where to go anymore with that one, but I think I have what you need. So, Mary, do you want to offer another try?
We we do have a couple of more things.
Okay.
Looping back to the see here, the lifetime signature, Tom. Is there special wording needed for that lifetime signature for the
We,
patient or the
correct.
beneficiary?
Yeah, and we can't advise you on that. That is something you have to go to a legal representative and get from them because it is, in essence, when you think about the lifetime signature and what they're saying is that I authorize you to file to Medicare. Legally, I authorize you. I'm telling you as a patient, legally, I want you to file to Medicare. So we, as a contractor, are not allowed to help you with that verbiage. Um, so I apologize for that, but it's just not something we can do. It's a legal statement.
Okay, as of right now, I have a couple of more. Can a patient request someone else sign the billing auth for them if they have a physical and mental capacity issue?
Oh, yeah, absolutely. I mean, if the patient requests it, document it. Hopefully that makes sense. Like, tell us why the patient's unable to sign or why they're requesting it. And that is then going to work as a authorization for that. So hopefully that makes sense, but I do need to know why.
Okay, one other question, just to verify, can the patient sign and we use it for future ambulance rides for the patient, or do they have to sign for every ambulance ride? And I think you've really summed that up well.
Yeah, can you tell me
Uh,
first, before we leave that one, what verbiage is in your authorization? If it says for this transport and you're doing it that way, then no, it's not for anything future. If it says for any transport in the future or something like that, then it could be used, but you have to ask your legal representative on that.
Great. Another question is, can the authorized rep be a nurse or a doctor, someone on the hospital or SNF staff, or a family member? Do all of the above apply?
So an authorized representative, so in the signature guidelines that I showed you, CMS does allow an nurse or an MD or a hospital representative or a SNF staff to sign. Okay, so let me just make that clear. They're not necessarily an authorized representative. What they are is replacing the patient signature to say, yes, this transport was completed because the patient is unable to sign. So instead, I'm using this signature. It's not necessarily an authorized representative in terms of that. A family member absolutely can be an authorized representative.
Okay. Another learner is asking, because they may have missed it, are two ambulance crew members' signature required, or is it only one crew member signature that's needed? The example given, Tom, is that the crew consists of two EMTs. Do we need both EMTs and the receiving facility to sign, or just one of the EMTs?
That's the tough one that I tried to explain a little bit there. So yes, you may have two EMTs on your rig. The answer to that is, did they both actively participate in patient treatment from evaluation to transfer of care to the facility? So, if only one did all steps, they evaluated the patient, the other one simply drove the vehicle, then the driver does not need to sign. On the other hand, let's do this. An EMT, the first one, the first person, they are the one that does the evaluation. The second one, after discussing with them, it's decided that they're going to do the patient and be in back. Well, the first one is the driver. And then once they get the patient there, the second one completes the transfer of care with the explanation. Both need to assign or assign, both need to sign because they both actively were involved in the care. It's really kind of answer the question who is actively involved in the care. And if you can't do that, it's always best to default to put both signatures on there. Always best to use that as a default. Sometimes someone asks me, what's my best default or what's the best way? Just having them both sign if it's ever in question. It's easier. That's up to you. I can't make that decision for you. I can give you a guideline. The guideline says this. Does that make it in practicality easier just to have them all signed? That's up to you.
Thanks,
All
Tom.
right.
I received a chat from the learner saying that she understands and she's got it. So great
Perfect.
answer, great question. Do you have time for more questions now, or do we need to move on, Tom?
Could we hold them just for a second, Mary, so then I can get through the last portion and then we'll be back to questions again, but I want to make sure I get through this facility portion as well.
Of course.
All right, here we go. So the last section talks about the facility and what facility can sign and when do they sign, because there are certain signatures that are needed. Okay, so let's take them in order. Let's take and start with sorry. There you go. Mary, did that slide change for you to sending?
It did.
Okay, sorry. It took me, like, it didn't look like it was going to change on my end. So, all right. So the sending facility, can they sign for a transport? The answer to you is yes, they can. What they're signing for is a one-time transport or an unscheduled transport, the medical necessity for that. This is in lieu of receiving a physician signed physician certification statement. Sometimes CMS will use the term non-physician certification statement or non-physician signature on a physician certification statement. And I'm sorry if that's confusing. It's really not meant to be. What I'm saying is there are times when a medical professional has to give their opinion as to why the transport is the only safe means. This is a physician certification statement. This is used when it is a one-time transport or an unscheduled, in which case a facility is able to sign saying it's medically necessary. Here's why we believe that. The staff from that facility has to know the patient. Like, kind of makes sense, right? I mean, we want them to know the patient. The receiving facility, on the other hand, is simply signing to say, yep, I got them. Our facility has received and the transport's complete. So Could be a nurse, it could be a care coordinator, whatever at that facility. Along with the facility, there is something that comes from a professional. Now, again, I just simply described this, a physician certification statement or a PCS, and it's signed by either a physician or a non-physician practitioner, and there are very set rules that go with this. This is from the Code of Federal Regulations, so I just want to quickly cover this, okay? Someone asked me about the valid PCS signatures. That's why we're doing this. It was a question y'all asked me on. So, first, a PCS must contain a reason for transport. It is the medical professional justification for why this is the only safe means of transport. Does it necessarily need to have the destination? Well, no. And let me explain that. It could be for a dialysis transport, but they don't know the dialysis center yet. They're working on coordinating that and they'll get back to you. Okay, that's okay. For a one-time transport, it could be to the local hospital for this test. Again, it's kind of a one-time transport. It's not scheduled. I mean, it could even be scheduled. It's just going to happen once. So it just depends on the situation. When it is a routine and it is scheduled, scheduled means 24 hours or more in advance. If you want to make it easier on yourself and you say, hey, I'm just going to use the day in advance, great, go ahead and do that. There's nothing wrong with that. However, the technical definition is 24 hours. Okay. If it is going to occur more than once, then it is routine and scheduled. Dialysis. There we go. Chemotherapy. There we go. Okay, they're going to occur more than once. Then it must be a doctor. If it's not signed by a doctor, it is not considered valid. On the other hand, if it will only be a one-time transport, I gave the example of they're going for a medical test, or it's not scheduled. So they could go for the medical test. You could know this 2 weeks in advance and schedule it at that time, but it's only going to be once and done. Then that's not going to be anything more than a one-time transport. Still scheduled, just a one-time. Now, it could also occur that, hey, we're calling you at 6 a.m. or at 8 a.m. We're getting it set up and they're going to go at 2. That's not scheduled by Medicare definition. Remember, scheduled is 24. So that's where we look at that. Now, if it's a one-time or not scheduled, then we can have a non-physician signature. From the Code of Federal Regulations, this includes a physician's assistant, a nurse practitioner, a clinical nurse specialist, a registered nurse, a licensed practical nurse, a social worker, a case manager, or a discharge planner. I also want to remind you that they do have to know the patient, like they have to know why the patient needs it. Otherwise, how are they signing this? So hopefully that kind of gives you a little bit of information on that. What I'd like to do now before I open for questions is to look at the sample physician certification statement and then give you some examples. So I want to let you know that WPS has developed a physician certification statement. It is a sample, it is not required. What we've done is incorporated one physician certification statement for all situations. So that means even when it's required for a physician to sign versus a non-physician practitioner because it's a routine scheduled transport, even when you're doing something for the prior authorization for the routine scheduled transport, this will work. But it will also work, hey, nope, it's not routine, it's not scheduled, it's not any of that, it's just going to be a one-time transport, or hey, we're going to go in a few hours, this will work for that too. If you go ahead and select the link on the slide, it's just going to automatically move you there. And it's available on our website, and you can see you can download it. Now, our website is wpsgha.com, and in order to find this, I will make a recommendation. Go to the website, come to the homepage, select the part of Medicare you represent, and then select Tools, go All Tools, scroll down, and you're going to look for the word Forms right here. Go All Forms. When you look at forms, you can type like PCS up here, it'll bring it up for you. You could scroll down to documentation, sorry, and bring up the header this way. So there's a variety of different ways to do it, but this is where you're going to find it. Okay. And go ahead and download it. If you can skip sections that don't apply, the first part does apply for pretty much everyone, except for the descriptions. Like, is this hospice related? Describe this as looking for a diagnosis. If you say no, obviously we don't have anything to describe. The second section is the most important section to make sure we have what we need, along with making sure you follow this section, which just talks about the signature. Now, I will tell you this is, again, not a mandated form. It was something that was developed to help you guys. Okay. So let's move on to some of the examples. So the first thing we need to know is a little bit about the actual ambulance run. So I'll let you know that in this example, I've given you all the signature pages that we received. What are you looking for? Patient, treating, receiving. That makes sense. No examples of attestation statements. We rarely get these, so I don't have any of those. And this is not going to be something that we can really look at. Okay, that's the facts and what we're looking for as we go through this. Can you identify a patient, a treating EMT, and a receiving facility? And I will show you every single one that we receive. All right. So in the example, the first thing you need to know, the care provided and documented by a primary caregiver. One caregiver equals one EMT. Printed names under the signatures. The EMT credentialing is on page 2. Question, is 2 EMTs needed for this one? This is something you guys have asked me, so that's the question we put in here. We're trying to use this as an example for that. So first, this is what the signature page looks like. Awesome, right? Here's a little bit about the patient, a little bit about it. This is their legal information. This is where it actually says, within this one, it says this is just for the transport because they're signing the record. It says that they acknowledge the privacy notices and all that stuff given. Here's their signature graphic, their printed name, and their signature. Now, one of the things I will tell you in the signature graphic, it says electronically entered by. That's great. They must have handed them like an iPad maybe or something like that. That's where it came from. Perfect. We're all good. No problems with the patient signature. The treating EMT, primary caregiver, EMS, I attest that I was present for this run and witnessed the care. Awesome. They signed it. Yep, we've got, hey, here's the unit, the patient name. So we know that this is what they're attesting to. Again, here we are. It's got an electronic signature. Here's the date of the signature. Here's their printed name. So it's giving us all of that. So just a lot of very nice information. The second one is just the facility. Now this one, it was not a printed, this was a handwritten signature. I just covered it up because it was pretty identifiable. Well, no, it was very identifiable. And so the person's name was there and I didn't want to be able to identify, but it does give you, again, the patient's name. Here's the incident number. This matches the record. And so then it tells us all the different pieces of information we needed. Here's the signature again and the printed name. What was great about this signature is you could actually read who it was, so no, this printed name wasn't required, but it must be part of their standard. So again, we're good. Secondary caregiver, during the record, it showed that this caregiver was not involved in any portion of the care, though they are considered the secondary caregiver. Okay. Does give the same information. I attest, we're good. We've got the printed name, all of that different pieces of information. I can see this is at the bottom of page 9, and there was an additional page, so I did cover up some stuff down there for that too. So when we talk about the summary, what are we looking at? Well, remember I said nowhere within the medical record did it show us that this second EMT was involved at all. So what does that mean? Do I need this signature? Nope. Is it wrong that you provided it? No, man, it's great. Actually, it's a really nice way to make sure you have what you need to make sure you don't get hit for a signature error. So I'm not going to discourage you from providing it. I'm going to say, hey, this was a best practice. It just wasn't needed in this case. How do I know that? Because under each section entered above, it did tell us who did it, and that was the primary caregiver. Would appear within the medical record that the secondary caregiver was a driver. All right. We're going to move on to example number 2. Fact. Care provided and documented by the primary caregiver, great. Printed names are used under the signatures. EMG credentialing is on page 3. What we're looking for is which signature is missing and why. That's what we're going to ask the question. So let's go on. First, this is the type of person signing. It's a healthcare provider. I acknowledge the above patient was transferred. Facility, who got them? That's all we're looking at. Yep, we got all that information. This one was a mark here. I kind of look like a squiggly, but they did give us a printed name, therefore it is valid. We're good. This one type of person signing is the primary caregiver for this event. Awesome. Good. EMT primary caregiver for this event. Again, 2 signatures. Now in this case, one of the EMTs did do the assessment, and then the other one did the treatment in the rig and the transfer. So that's why we have to have both of them. This one was one where we absolutely needed both of them. This one, it says it's not signed contamination or physical impairment. So we know that the patient did not sign this. The signature reason, not given. The paragraph text, not given. This is just simply saying, hey, it wasn't signed. Well, was it a physical impairment? Was it a contamination? Why wasn't this signed? Instead, the EMT signed it to say it was not given. By the way, it was EMT 1. We do have a printed name for that. But what do we not have on this one? The reason the patient couldn't sign. We have a very generic reason, not good enough. This one was denied for patient signature. So medical review did occur on this claim and it was denied for patient signature. This is just a narrative from that, and what we are looking for is why they could not sign. So it does say, hey, they were issued dispatched to urgent care. Good. Upon arrival, patient was sitting in the hospital bed. Good. Patient actually felt fine. Just had been feeling a little sick. Okay. The PA reported to EMS that the patient has pneumonia, etc. Patient was unsteady on feet, but reported that they were not feeling sick, weak, or dizzy. That's an important part of it. Patient was secured to the stretcher using seatbelts and rails. Patient then brought to ambulance. All of this, but nowhere in here does it tell us the patient was unable to sign. Nowhere in this mentioned that it says that. Now, I did have a couple of questions where people were saying, hey, this doesn't even look like it's medically necessary. I'm not sure. That's not what we're talking about today. This is just an example. What we were looking for was why didn't the patient sign the run report? So hopefully that helps everybody, kind of tells you a little bit about what we would do if there is no signature. Example 3, care provided and documented by the primary caregiver. There are printed names under each signature. The EMT credentialing is on page 4, but what signature is missing? What signature is missing? Example, here's the patient. Okay, yep, they're released for billing. Awesome, they signed it. Okay, it's got the signature, it's got everything we need. All right, so the patient's good. Patient unable to sign. The EMT did sign, saying the patient's unable to sign. Well, didn't we have that one slide before? So in the medical record, the first thing you have is the patient's signature. The second thing you have is a statement saying they were unable to sign. That doesn't make sense. The third statement is from the healthcare provider saying, yep, we got this. That's it. No more statements. What statement's missing? How about the EMT's verification that all the information is accurate, that they performed the service? All they said was, hey, the patient wasn't able to sign. That's where the question and the information within these verbiages is very important. Okay, this is a legal statement. So all they're saying is, hey, this patient was unable to sign. Well, either one of the EMTs could have attested to that. And we don't have anything stating that they did that. Okay. That brings us to, oops, sorry, I'm going the wrong way. I'm so sorry, y'all. Let me get back down to that question and answer slide. What I'd like to do is just give you guys a few questions from the pre-submitted questions. You guys have heard a lot of the stuff that was already submitted. Then we'll follow up and do some other questions. So, what do we do when you cannot get a signature after months after the attempts? My question is, whose signature? If it's the patient signature, then you bill the patient because they're not authorizing you to sign. So you make a note, patient unable, patient refuses to sign, patient refuses to respond, whatever, and you bill them. As long as you've got that, you're good. Now they do have 1 year to respond, 1 year from the date of service, 1 year from the time of transport. Okay. If it is a physician certification statement, there is guidance in the Code of Federal Regulation, and you will want to make sure you follow that to make sure that it's there. Definition of closest facility, the rural options are hard to determine. Medicare uses the definition that the facility has to physically, distance-wise, be the closest, and they have to have the bed, staff, and equipment available to treat the patient. If they don't have any of those three, they are not considered the closest facility. Also, they may use locality within that, which just simply means, hey, where is the patient likely to go? So let me know if you need more. Someone asked, can the police sign for the patient at an emergency department? And do they follow that guidance given? Is that someone that's listed within there? Normally it is not. They are not an authorized representative. They are not under the guidance for the patient signature, but please follow the guidance within that patient signature. If you have legal questions about that, this is a signature requiring from legal. Make sure you contact a legal team and find out. Do the crew members need to sign first, last name, and can they use nicknames versus legal names? Uh, Again, a nickname is fine, initials are fine, squiggly marks are fine, marks are fine, as long as it also contains something indicating who that crew member is. So, yeah, that's fine. Can a Medicare patient be sent to collection if they do not provide a signature? Yes, that patient is then liable for that transport. They must authorize you to file that. The exception is if you happen to have a signature on file or a one-time signature page and it has that verbiage within it. Are EMT medics required to take this course? We cannot require them to take this course. Instead, we're providing you the information. Whether you are a medic or not, you must use this information and then pass it around. How do we get more reimbursement as what we're getting paid doesn't cover expenses? CMS sets the reimbursement level. Please contact CMS. Is an ABN never required in an emergency situation? How is an emergency situation determined on a 911 call? How does a crew decide if an ABN is needed on a 911 transport? Remove the 911 transport from it. Yes, I understand that's how your call was dispatched. Yes, I understand you can be dispatched emergent or non-emergent. But when you get there, did you find that the patient's condition drives whether or not it is an emergent or non-emergent, or an emergency transport or a non-emergency transport? Okay. What does that mean? How many of you have been dispatched 911, got there, and the patient's walking around, moving around, and they say, oh, I just need to go to the doctor for? Okay, that's a real life situation. We've gotten that question a lot. Probably not. How many of you guys have gotten there and been like, oh, wait, this patient, called saying, oh, I don't feel well, but you get there and you're like, dang, we got to get in there right now. Okay, that's what we're looking at. What's the urgency once you've assessed the patient? It's not just about the 911 call. Yes, that will drive the type of rig that's sent. Yes, that can drive some of the elements of reimbursement. However, it does not make it automatically payable. Again, there's a question on a relative signing. I've addressed this several times, but please make sure that you're reading the Code of Federal Regulation, and it is 424.36B 1 through 6 for this information, and then refer back to the guidelines. I'm going to go ahead and actually stick that in the chat for you just because I have it. So that will get you what you need to make sure you have that. Okay. Is a signature required on a face sheet during a transport? The run sheet has already been signed. No. I need one signature, whether it's on the run sheet, the face sheet, or a signature sheet. It doesn't matter. Specifics for electronic signatures. So here's what has to be there. A verbiage indicating it's an electronic signature or verified or authenticated by date and time stamp, and that there is an encryption software. We don't come out and look at your software, but that doesn't mean someone else couldn't. How does a witness come into play for a patient signature with illegible signatures? As is their address really important? What happens if there is no credentialing listed on the witness? The witness doesn't have to have credentialing. The witness could be someone like a neighbor. Hey, I got this. Do they necessarily have to sign? No, the person that they're giving it does. So the EMT took a witness statement. Here's the who the witness is, and here's the information they gave. The witness doesn't have to sign for that. I'm not really sure exactly where to go with that beyond that, so hopefully that answers that question. Um, for the receiving facility, is the first initial and last name and signature required? Yep, the signature is required, but again, it doesn't have to be valid if they use initials or they use a first initial with last name or something. We always do recommend that you include their medical documentation, or who they are, what they are, whatever it needs to be. All right. I know that we're right at time, so I want to give you guys and say, hey, thanks for attending. I do want to let you know I am going to go ahead. So if you still have a question and you want to stay on, awesome. Please take that opportunity. I will have Mary put a link to the survey in there. We'll get more into that. Other than that, though, I do want to give you guys the opportunity to answer just a couple of questions. So Mary, any more questions in the chat?
One second, Tom, I'm popping that survey link into the chat. Everyone, we hope that you take the survey. Great information, Tom. There are a few additional questions, and I know that you're going to share with everyone how you will send a response if we don't get to them. But here's the first one, and it's just a confirmation that this learner understands correctly. If that patient doesn't have capacity, or does have capacity rather, but the patient just simply doesn't want to sign. They want the EMS to sign for them. Can that be documented and then billed to CMS? And the learner believes the answer to that is no. Can you confirm that?
That is correct. If the EMT is signing, it has to be a reason that they can't sign. If they're saying, I don't want to sign, what that is actually saying is, I don't want you to bill Medicare. So that's the basic gist of it.
All right, next question. Would a PCS then not be required for a patient that came in to the ED at 9 a.m., then at 4 p.m. they are going to another hospital? Would it fall under a non-emergent and non-scheduled transfer since it is under the 24-hour time frame?
That
If you
sounds like a
needed,
one, oh, sorry, that sounds like a
there was
one-time, which is still could require a PCS, but it could be signed by a non-physician practitioner. So if you want to say a non-physician certification statement, that's okay. Could also be a physician certificate. You could call it a physician certification statement with a non-physician practitioner, however you want to do that. This sounds like the patient's stable. It sounds like, hey, there's a reason they need to go. So it sounds like it would be needed from the question, but it doesn't sound like it needs to be a doctor signing it. On the other hand, it was the extra criteria, the people that I gave. So next.
Is the receiving facility staff signature required for billing?
Is the receiving facility signature required for billing? Yes, it's for proof of transport occurring.
Under the printed names, do you just need first name or full name if the signature is not legible? And if the healthcare provider signing, do you need credentials? I think this is something you touched upon already,
Yeah.
but just for confirmation.
I would always tell you it's better. So first of all, yes, you need first and last name. It's not really an option. I have to know who the person is. So if it's just a first name, that's not going to help us with anything. It has to be first and last name. Second, if it's in the situation where there are credentials, yes, you do. We ask you to please incorporate that, um, because that helps us identify. So for instance, if you are a ambulance supplier and you have an EMT basic named Tom Ryan, but you have an EMT paramedic named Tom Ryan, how do I know which one it is? That's why we recommend it. So, yes.
All right, Tom, we've gotten to all of those questions, other than someone did ask about how to submit a question if they think of one later. And I know you're going to cover that.
Yeah, I haven't got that far yet, but we'll get it in just a moment here. So, all right. So, just as a reminder, questions, yes, you can submit them to me. It's going to be on the last slide. I'll talk a little bit about that. I did have Mary throw the link to the survey in the chat. You'll also be given the opportunity when this webinar is done. It's going to look like an external little pop-up up here. People ask me all the time, is this phishing, malware, or whatever? No. It's us asking you to take our survey. Look for the external site with the little triangle. It'll have a blue continue button, but please make sure also that you'll see CMS, MAC, Fed. That's just the survey, so please take that. Again, a couple of simple questions. I shouldn't say a couple, I should specify 5 simple questions. And then if you want to give additional, you say yes, and there's more offered. If you're taking this as an encore, you can take the survey by using the picture. It looks like the bottom link here, and you can select that. That'll open the survey link. Okay. Be honest, give me the provided feedback. That would be great. Couple of things to keep in mind. I will take questions. The questions will be taken for the next 7 days. What you need to do is email us. So the email link's probably in the chat if you want to grab that. But if you did not and you're on the phone, write this down: wps.gha.education@wpsic.com. Again, ambulance signature webinar, ambulance webinar, something like that. What we're looking for is just so that it can get to me and I can answer your question. A few minutes from now, you're going to get a follow-up email, and that email will again give you a link to the survey. But I want to remind you that if you need continuing education units, we don't actually issue those. What we do issue you is contact hours, and that email will have those. So please just don't automatically delete it. Again, thanks for listening. We really appreciate your time. If you have something that I didn't answer, we will get back to you in an email. If you want to make sure that I have it, email it as a follow-up question, and we'll get back to you. Please remember, it can take up to 30 days because I got to compile all the follow-up questions, get through them also depending on how many I get. So thanks, everybody. Mary and I would like to thank you for your time, and thanks for attending. Thanks for all the great questions. Y'all have a great day. You may now disconnect.